How can I stay positive with terminal diagnosis where no doctor, no family member supports my cancer? But how can I be so positive about my life? If you are really, really in pain, you can't be positive. Where is the pain is coming from? Most likely inflammation, malnutrition, lack of movement. That's why diet and exercise, they matter. They don't care where you pick up the cancer or not. They are just caring about, surgical removal, chemotherapy, radiation, nothing more, nothing less. GI issue, especially bloating, went away. It was the first time for me to see my tummy flattened. My energy went through the roof, but I couldn't see myself energized until I took on the carnivore diet.
Okay, hey guys, welcome back. We've got Sami with us again, and she is going to share with us her updated journey on her sort of battle with cancer. She's a stage 4 colorectal cancer patient who has a unique story. So Sami, I'll just let you maybe reintroduce to the audience a little bit about yourself, your background, and then how things are going.
Yes. Hello, everybody. I'm Sami from Japan. As Shawn mentioned, I'm a cancer patient. Stage 4 colorectal cancer. The thing is that, yes, a year ago, I was on your show and I talked about my cancer journey. But this time though, not only update, but also I'd like to elaborate on my veganism journey, the early life, all of that. Let's start from my early life and veganism. At the age of 6, I became a vegan, not because I wanted to save the planet, just because of the fact that I had a lot of skin issues, especially eczema and allergic reaction like hives and stuff. My dermatologist decided that the reason I had a skin issue was because I was eating animal flesh. Since then, I became a vegan kid, malnourished. At the same time, I was raised by a single mom. I was born in 1902, countryside in Japan, one of the most conservative countries. And for my mom, it's difficult for her to figure out how to raise fatherless child. So she decided to take on new job, which is a nighttime job, meaning that at the age of 4, I was abandoned in the sense that she left my place around 4 o'clock p.m. She's not going to come back until next morning, meaning that I was completely alone by myself at the age 4 already. But she left plenty of food, malnutrition, plenty of food, being extremely lonely, 4 years old. These are the perfect recipe for eating disorder. I'd like to elaborate on eating disorder part if we have a lot of time later on. And then, at the age 15, admittedly, I developed severe eating disorder, very severe one. I was always bulimic. I went to psychiatrist. The thing is that despite the fact that the psychiatrist had published several books. They are all about mental illness and stuff. But he didn't know anything about bulimic conditions. He knew little about anorexia, but I was diagnosed as the person who can't stop lying, like a pathologic lying, as they say. And then I was given the 17 tablets a day, tranquilizer, stabilizer, antidepressant, you name it, a sleeping pill as well. Yes, it didn't help, obviously. And then I developed life-threatening purging behaviors, 2 behaviors. One is obviously self-induced vomiting. I did that once or twice or 3 times a day. Sometimes I cut my throat and esophagus and so the blood. And then also another purging behavior was taking a lot of laxatives as a compensation. I wanted to get things out. And the thing is that I took the laxative almost every 2 hours, my waking time, to the point that I took 250 laxatives a day. Obviously, you can imagine that my life, many trip to bathroom and a pain, shame, and I wanted to kill myself. It's lasted 25 years, nearly 25 years. But the thing is that the fact that I was always interested in biology, biochemistry. I took a correspondence course to get some knowledge. And then fast forward a couple of decades later, 2017, I came across some articles which are all about ketogenic diet. Actually, the ketogenic diet originally designed for kids with epilepsy. Interesting thing though is that when I went to psychiatrists, they prescribed me anti-seizure drugs. And then I go, ketogenic is anti-seizure efficacy. Maybe it might work. Guess what? It worked. My terrible psychiatric conditions dissolved from ketogenic diet, although I was plant-based ketogenic dieter, admittedly. And then the thing is that ketogenic diet, yes, helped my psychiatric, eating disorders, but ketogenic diet didn't help my gastrointestinal issues, especially bloating and pain. So, but luckily, 2018, I finally found a carnivore diet. That was the true game changer. 3 benefits I can recall. Number 1, GI issue, especially bloating, went away. It was the first time for me to see my tummy flattened. First time over the course of my life. From day 1, carnivore. 2, my energy went through the roof. Previously, despite that I was ketogenic dieter, I think that my weight was 70 pounds for 32 kilograms. And I'm 5'2", emaciated. Even I was drinking a lot of olive oil because I was prescribing Dr. Stephen Gundry. Olive oil is good for you. But I couldn't see myself energized until I took on the carnivore diet route. And another thing is that intermittent fasting. This is the time Dr. Jason Fan started to talk about intermittent fasting is good, autophagy, and all of that. I wanted to try that. But being, let's say, plant-based ketogenic dieter, longer than 40 hours fasting was too heavy for me. I couldn't make it. Despite of the calorie intake coming from plant oils, many oils, but I couldn't make it. But ketogenic diet, everybody knows this. If you're on a ketogenic carnivore diet, intermittent fasting is so easy. Even you don't need to think about when I'm going to break my fast. Just naturally, my eating time or fasting time is 18 hours, 19 hours, just a sweet spot. No effort. 3 big benefits when I think about when I switched to carnivore diet. I was experiencing overall health improvement. It lasted 2 years after that. But 2020, there are many publications all about microbiome. They started to talk about the microbiome and feed the microbiome with fiber. This is a kind of a general idea of to have good microbiome. And then I bought this idea. I should try that. Then I incorporated some of the fibrous green vegetables into my Lion diet. I had been Lion diet, just ate beef. Until 2020, April 7th, after eating beef and some fibrous vegetables, I noticed that some dull pain in my stomach. It was intensifying. And next morning, that pain became excruciating pain. That pain allowed doctors to discover the fact that I was incubating very advanced stage of cancer. Stage 4, terminal colon cancer, already metastasized to the liver, the lymph nodes and stuff. I underwent very intensive, very challenging, painful surgery. But unfortunately, I had to experience a complication that needs another surgery. And then recovering from the big surgery, I started on the chemo. Month 2, already they discovered new metastasis to my liver already. I was gaining the understanding the fact that conventional approach is less effective than we want to believe. But the thing is though, I wasn't so upset because of the fact that before I was diagnosed with terminal, I had known about ketogenic diet for cancer approach. I had known this stuff. On top of that, given the advice from Dr. Seafree, well-known cancer biologist, everybody knows like now in Boston College. And according to his theory, not theory, this is a fact, that cancer gets fueled by 2 energy substrates. One is mainly glucose. Everybody know sugar feeds cancer. And one of the other substrate is glutamine, one of the amino acids. And in terms of the reducing your glucose level in your system, ketogenic diet is good to go. But in terms of the glutamine, whatever you eat, glutamine is in it, basically. That's why, according to his protocol, as a cancer patient, we have to take glutamine blockers. And I almost knew this stuff before my diagnosis. That's why I wasn't so upset. And also, I started to check the GKI number. GKI stands for glucose keto index. As I mentioned, that cancer thrive on glucose. That's why low glucose and then high ketones. The thing is that your body can utilize glucose effectively, but cancer cannot use ketones, meaning that low glucose, high ketone is beneficial for cancer treatments, obviously. I was easily achieving the low GKI number. This was 1 year before I was on your show 1 year ago. Actually, this is the interesting information. 3 months before I was on your show, I had 2 CT scans. What discovered was the fact that I developed new metastasis in my lung, which was growing, but for some reason, I wasn't realize the seriousness of metastasis. Reasons why I was not fully aware of that. Number 1, no symptoms. I was always happy, then strong, then going to the gym, all of that. Number 2, it was second metastasis. What's new? I wasn't realized. Number 3, again, full of energy. Why bother to think about metastasis? And then, years later, I was on your show. Thank you very much for the fact that being on your show, I was able to connect with wonderful, beautiful, incredible, supportive people in my Instagram channel. And then the thing is that I'm going to repeat myself again. Being on your show, I was making a crucial mistakes, 3 mistakes. But the thing is that because of the wonderful people being in my Instagram channel, from one of them, she's a cancer biologist, and she actually is helping cancer patients herself. And she's Pia. I have to big shout out to Pia. She saved my life. She was emphasis on importance of achieving low GKI number, which I forgot already. And since she was persistent, little bit being annoyed, but anyway, I checked my GKI number soon after I was on your show. What I noticed was that my GKI number was alarmingly high. And then finally, I realized that, I was doing something terribly wrong. To get that, I'm going to explain the 3 mistakes before I'm going to talk about nitty-gritty part. 3 mistakes I was making even I was on your show. Mistake number one. I was too healthy, too excited being on a carnivore. That's why totally I was forgetting about I was cancer patient. Cancer is no joke. You shouldn't forget about your illness. It's a serious disease. Mistake number two. My goal setting should have been cancer management. But my goal setting at the moment, even being on your show, my goal was fitness. I wanted to be bigger, faster, stronger, agility, power, hypertrophy, all of that. To achieve this, general advice goes, especially dietary intervention, increase protein intake. Yes, I did that. But the thing is that increase the protein intake by eating a lot of beef can be pricey. Then I incorporated, let's say, pork, chicken, fish, eggs, many variety of meat. This is a mistake number three. Why it was mistake, I'm going to explain to it later. Anyway, noticing that my GKI was so high, I have to get the GKI number low. First attempt I did was increasing the fasting time. As I mentioned, it's easy for me to do 19, 18 or fasting. But after 20 hours, my body refuses to function. I'm going to be grumpy, snappy, less motivated, fatigued. I couldn't see myself at all, and I gave up. And then what I realized was that when I was able to achieve low GKI number, I was on lion diet, only beef diet. And then I tried the lion diet, only beef diet. Boom, my GKI number dropped. Now I'm going to explain mistake number three. Eating a variety of meat was mistake. Let's think about the digestive system of ruminant animals. Ruminant animals, which is cows, the bisons and sheep and stuff. They have 4 stomach chambers and unique bacteria. They can digest the processed food slowly to the point that they can detoxify the food they are eating. Conventional way to raise the cows, the end of their life, they could be given the corn, the soy, and stuff. But because of the 4 stomach chambers, unique digestion system, they can detoxify to the greater level to effect. And then in contrast, pork and chicken and fish kind of stuff, they are monogastric animals, hence the name. They have 1 stomach, meaning that what they eat, it's going to reflect on the flesh. In my case, only in my case, I might have an immunological response or let's say inflammatory response to eating 1 of them, 2 of them coming from monogastric animals. That's why when I eat them, maybe there is a kind of a stress response to my body. It's done, your liver releases some glucose from that stressful response. And then that's why my body was not able to produce enough ketones. That is my assumption. I might be wrong, but this is a way I'm understanding why I should be lion diet. But one thing I want to mention at this point is that please don't assume that eating the chicken, fish, egg is bad. The people who have to think about this element is people who got cancer or severe neurological problem or let's say autoimmune disease or kind of stuff. So that's why normally carnivore diet, normal carnivore, conventional carnivore diet incorporating a lot of animal kingdom. I wanted to clarify that. Sometimes I get asked, shall I be strict lion diet to lose weight kind of stuff. That's why I have to mention this point. So what is a consequence of the mistakes I was making is I allowed myself to develop new metastasis to my lung. Actually, I haven't been to a hospital because the fact that this medical system, just monitoring patient is not their game plan. That's why they stopped asking me to go back to the hospital to check my cancer is going. So I happen to know what is going on, my lung cancer, liver cancer. But obviously, I happen to drop to death despite the fact that being told delaying 1 month of surgery for metastasis, meaning a death. But look, I haven't dropped to death. And the thing is, I act with from knowledge, from my mistakes I made, and the achievement I making right now. I'm able to support people with cancer right now. I really appreciate my circumstances quite a lot. This is a quick update. So not quick. It's digested a lot of time. But anyway, this is my update, so to speak. Shawn.
Okay. All right. Interesting. I just a couple questions. One, you said you were on a vegan ketogenic diet. I'm just wondering, what do you eat on a vegan ketogenic diet?
Yeah, I know. I wasn't a vegan. It's a plant-based ketogenic diet, let's say. Yeah, bunch of green vegetables. And my digest system was bombarded with green vegetable and a bunch of olive oil. I truly believed that olive oil is the best oil for human being to consume. It's
okay,
obviously
so
bad.
Lots of olive oil and green vegetables basically was your diet.
Yes, indeed. And then as a last dessert, I allowed myself to eat 1 egg, maybe a day or maybe 2 eggs a day. I was still not sure I'm supposed to be eating meat because meat causes cancer, meat causes everything.
Interesting, because you said you had this eating disorder which affected you many years. You went vegan, you went keto. Then you finally went carnivore, and then after going carnivore is when you discovered the colorectal cancer. So because it was quite advanced, do they think it was in place for many years prior to, or what was
right.
Thank you very much. What did the doctors tell you? Yeah.
I should have mentioned that doctor says nothing. My doctor says nothing. They don't care where you pick up the cancer or not. They are just caring about, surgical removal, chemotherapy, radiation, nothing more, nothing less. But my assumption goes like this. I was taking laxative, 250 laxative a day for 25 years. Here's the thing. Our body is very capable of taking care of the big bout of stress. Dr. Baker, you do deadlifting, hundreds of pounds of deadlifting, really taxing on your system. Your skin is almost the fire and a burnout. That's the level of the stress. But because of the fact that your stress time is just a couple of seconds, minutes, and all of that. But the stress I experienced was decades and decades of prolonged irritation every day. That's the level of the stress our body is not very capable to address. That's why majority of the cancer-causing elements are prolonged irritation, like over and over again, to the point that your mitochondria gives up completely. I can't make it. And they become cancerous. So to go back to the original answer to your question, yes, my original formation of the cancer is coming from prolonged laxative abuse. No doubt about that.
And it's the other thing, because I know we're talking a little bit about cancer, but eating disorders are very, they have a high mortality rate. Women that have things like anorexia, many of them, they don't survive a long time. And what's that?
Can I elaborate on eating disorder topic? This is something I'm more knowledgeable than cancer biology, actually, because I've been there, done this for 24 years. I know everything. Interesting thing from my point of view is that eating disorder is normally categorized as mental disorders. Everybody says that. That's why you Google it. How to cure eating disorder. Result is going to seeing a psychologist or meditation or cognitive behavior, whatever it is. It's something to do with your psychology. You have to fix your mental capability or whatever. Yes, it's legit. Of course, nothing wrong about mindful eating, all of that. But in my opinion, eating disorder is nutritious deficiency disorder. Definitely stem back to the nutrition deficiency. Let's think about this way. Your body, let's talk about like a history of human being. Biggest killer is always starvation. famine, more than just the murders and wars and sea virus. No, starvation. That's why our body is very equipped with how to deal with starvation. That's why if you cut the calorie or excessive long running or so your cardio, your body senses as, oh, maybe starvation might come up. So that's why prepare for that. First thing your body does is get you be hungry, give you some motivation to find the food. It's normal. It's normal. Binge eating is like a more fundamental human survival response rather than mental disorder. Even everybody, even Dr. Baker, if you skip the meal, next meal, you find yourself overeating. It's a normal stress. Your body is always trying to keep the balance of calorie intake and calorie the expenditure to survive. That's why just focus on the psychology is, I would say, secondary or the last thing you need to work on. First thing that eat enough calorie, especially fat. Why fat? So many things I have to talk about. These days, there are many people or influencers, doctors, talk about importance of the increasing protein intake. Yes, it's true. Protein is one of the most important nutrients. Yet, in terms of the eating disorder, I believe that you need to increase the fat intake, maybe 2 reasons. One is that, yes, protein gives you satiety, but 3 hours later, still hunger returns compared to that you are increasing a fat in your diet. Number 2 is that the fat intake, increasing the fat intake, that's going to facilitate ketone production. Everybody knows ketones suppress hunger. And then most importantly, your brain has been so tired with thinking about calories and my body image and food and not eat, binge, all of that. That's why to heal your brain, ketones is very, very important. That is why I was able to recover from eating disorder because of the fat. Even though the fat was coming from olive oil, still it counts. Fat matters. And then now I'd like to focus on the, let's say, addiction aspect. Still, I would say many people who have an eating disorder, they have an addiction problem. They have a bad relationship with sugar, let's say. And then the thing is that sugar is, in my opinion, almost legalized recreational drug. It's a substance. To cure your substance addiction, you have to be abstainer rather than moderator. You can't say alcoholic, hey, drink alcohol moderately. It doesn't work. Same goes sugar addiction. So next thing, after having plenty of calorie from fat, next thing you have to focus on the sugar addiction by being not moderator, abstainer. That's the part. And then lastly, you are going to focus on your psychology. Now you can incorporate meditation, the mindful eating, but I'm not sure eating candy mindfully I don't think it works. Still, nutrition matter. And my approach to psychology is not going to the psychiatrist or psychologist, all of that. My approach is finding your new goal, which is unrelated to diet, unrelated to like exercise, like picking up the new instrument, learning new language, something, nothing to do with your eating. That is very important. That's going to pick you up. That is my approach. I almost every day, I'm getting some DMs. They are having eating disorders rather than cancers and stuff. Yeah, I always talk about this stuff. Your brain is working as it is. It's just that you haven't given them the proper nutrient, especially fat. And then trust yourself, trust your physiology rather than psychological aspect. That is my shorter version explanation.
Okay. And your cancer diagnosis was 2020, right? Is that correct?
2020, correct.
Yeah. So almost 4 years ago, then something like that?
Oh,
3.5?
3 years ago, 3.5, somewhere around. Yeah.
3.5 years ago. Okay.
Mm-hmm.
And so you found that you had a lung mass, you had liver metastases, you had an original surgery for the main tumor, I guess.
Yeah.
The metastases they can't really operate on.
No.
What is the status? Because I see you on social media. You're in the gym, you're working out, you're very positive.
Mm-hmm.
And how do you feel these days? Are you
yes.
feel pretty good?
I'm fantastic. Yes, thank you very much for that question. Actually, you asked me the same question. One of the questions that really lingering on my mind was, how can I stay positive with terminal diagnosis where no doctor, no family member supports my cancer? But how can I be so positive about my life? I am going to say, I think 4 points in my case. Number 1 is knowledge. Knowledge is power always. The thing is that, as I little bit touch upon the fact that when I was diagnosed with death sentence, terminal, you are going to die. Previously, I had known about ketogenic diet for cancer treatment, knowing that I was doing something right. And then also, I knew doctors didn't know about ketogenic approach for cancer treatment. Knowledge is power. Literally, we have to know about your illness. This is one of the way you can be positive with deadly any condition whatsoever. Number 2, in my case, my goal isn't just a survival from cancer. My goal has been always building strengths. Building strengths really excites me. Especially the goal setting is important because my cancer is no joke. Everybody is dying. But the thing is that having a goal, especially measurable goal, in my case, I'm able to lift heavier. You got to see you improve. Goal setting unrelated to cancer is very important to my cancer journey. And number 3 is pain. What I mean by pain is that if you are really in pain, you can't be positive. That if you have broken bones and stuff, you have to be in pain. No doubt about that. But most of the people, including myself, where is the pain is coming from? Most likely, 3 reasons. Number 1, inflammation. 2 is malnutrition. 3 is lack of movement. That's why diet and exercise, they matter. So when you think about being positive, we always think about psychology. Hey, look at the bright side. Again, meditation to be positive. But still, your psychology matters. That's why we always think about your physiology by eating proper food, needless to say carnivore, and exercise. I can't say enough. Exercise matters. Not only how you look, but also your positive mind. Very, very important. And then lastly, 4 points is that this is something I'm almost happy to be cancer patient in the sense that knowing that our life is very, very short. My life is short than I thought. Meaning that every day is a bonus. I can't recall how many times I've been told, I'm gonna die. This sentence many times. To the point that's made me realize that waking up, I have another day is a bonus. On top of that, I'm able to go to the gym. I'm able to hit something PR. I'm 51. So I can do it. Jumping, all of that, which absolutely privileged. And also, these days, everybody is suffering from the kind of inflation, the political situation. I'm able to eat beef every day. how privileged I am. Look at global picture. Many people still can't eat meat, animal food. Just rely on the cookies and crackers and because they have no food left. In this context, I'm very privileged. I think that being positive is that realizing these kind of small things. Little to do with carnivore, but it is true that 4 points, they are really supporting. And also, I have to mention this. Because of being on the presence in your show 1 year ago, I was gaining that wonderful, incredible, supportive people in my tribe, in my community. Literally, I'm getting good vibes every day from them. How privileged I am. This is a sources of my positivity.
That's wonderful. And you said, because we had talked a few weeks ago and then the recording got lost, unfortunately, but you said you'd even had some updates since then, I think, if I'm not mistaken. I think you said some other things that occurred.
The update was just something I have mentioned that being on your show 1 year ago, I was making a mistake where I was overconfident. I thought that being on Carnivore, you can get away with everything. Hey, bring on the cancer metastasis. I wasn't realized. This is the one. I think that, let's say, one thing, if you ask, what is the negative aspect of being on Carnivore? Is that you are too you healthy? I don't know what the kind of oxymoron. Too healthy. You are too healthy. Sometimes you don't realize the seriousness of your comorbidity to begin with. That's why I increase a lot of. I think a year ago, Shawn asked me that, oh, what you are eating? Then I go, oh, I ate eggs and chicken and pork and beef and everything. And I'm quite healthy. Look at me. I'm surviving, just to eat everything. It was a mistake. Sometimes, because of the too healthy condition, gives you a false sense of confidence. That was my mistake. This time, I thought I was going to emphasis on that. Otherwise, many cancer patients are following me, thinking that, oh, what Sami does, it's going to be good. Okay, I'm going to follow Sami. I'm going to mimic Sami's way. That's why I have to make sure that this was a mistake. You have to be very meticulous about GKI number. GKI number matters the most. The thing is that I have talked to many cancer patients. Thankfully, I'm helping them. And some of them aren't carnivore. They are plant-based. I don't mind if you are vegan, if you are able to achieve low GKI number, but it's very difficult. Can I interrupt me by talking about a vegan juice diet a bit?
Yeah, sure, of course.
Yeah, I'm getting asked about what do you think about this lady who survived through vegan juice diet. Yes, there are actually many people, they did that and they survived. The reason was because they had to do way prolonged, painful, very almost pathetic, longer fasting, sometimes a month. Let's face it, cancer gets fueled by glucose. While you are ingesting it, to use up your glucose, glycogen, you have to do longer fasting. They did, that's why they were able to survive from the cancer. At the same time, they lost hell of a lot of muscle, went into that vitamin, nutrition, many deficiencies. It doesn't have to be this way. The end result can be the same, full of ketones, but a carnivore approach for cancer treatment, you don't need to starve yourself. That is a great aspect of the carnivore approach for cancer treatment. So going back to the vegan juice diet, there are social narrative. Fruits and vegetables is always good. And if you Google cancer fighting food, there is no meat. Always fruits and vegetables, and green rainbow juice, all of that. I think we have to change this narrative. I always get passionate or get fired up to talk about the vegan juice diet. absolutely nonsense. Sorry.
Yeah, I can see that. But it's probably, there's a lot of people that see these movies on juicing and they do that. And
Yes.
if you think about the practicality
Why do you do
of
this?
where would early humans get vegetable juice from? You just wouldn't. It would be impossible. And so
Right.
the reason we have a blender that was invented, maybe electric blenders only been around for maybe 100 years at most. And so vegetable smoothie things are outrageous.
Quite new. I am debunking not only juice vegan diet for cancer treatment. Of course, there was alkaline diet for cancer treatment. Absolutely nonsense. I'm debunking this kind of diet for cancer patient, or meat causes gout. I was debunking that. And also was the fiber myth. I was debunking that. So many plant-based push. So strong.
We're seeing a lot of data come out that calls into the question of things that we've been seeing clinically. I'm observing people get better without fiber. I'm obviously observing people getting better without any significant plants in their diet. So there's got to be some disconnect there. Otherwise you would expect to see everyone on a carnivore diet progressively get sicker, and we're not really seeing that at all. In fact, we're seeing the opposite. So you had a couple of questions that you asked of me, and I'm happy to. You wanted to know about metabolic flexibility and calcium.
Okay, that sounds great. Before that, one more thing. I just wanted to mention about my vulnerability. People assume that, Sami is a superwoman. They're fighting cancer. She wins. But the thing is that there are some challenges for my cancer journey. And the thing is that, I don't do prolonged fasting. According to my memory, most all cancer survivors using metabolic approach, they do longer fasting. 2 days, 3 days, 4 days, a month, they do it and survived. For me, for some reason, maybe I'm loving too much meat, so I can't do longer than 20-hour fasting. This is let's say, I have to declare that. And although I recommend the people who approach me to ask my opinion about their cancer, to say, hey, if you can, try long day fasting, but I cannot do. Number 2, I don't eat grass-fed beef, although they say, if you want to, control your cancer or cure cancer, you have to eat grass-fed. But for some financial constriction, that not available to procure grass-fed beef in Japan, the producers are almost promoting the grass-fed beef as a better option, more healthy, more organic, whatever. That's why we don't have a grass-fed beef as much as we should have been. So I don't eat even I haven't eaten grass-fed beef over the course of my 51 years life. I haven't. This is my disclaimer. Number 3. This is something a little bit have a hesitation to share this story. And since I was 15 years old, I was given the 17 psychiatric medicines, one of which was sleeping pills. Since then, I've been on sleeping pill until this day. Still, I've been on the sleeping pills. Of course, I've been working on it, cutting the dosage half and quarter to the point that I've been on 10% of the original dosage, which I'm proud of. It's very difficult. And I have to mention this. Everybody thinks that Sami is perfectly lives her life. But sometimes I have this kind of some crutch. Then finally, number 4. Yes, I am tracking GKI number. But the thing is that this is something maybe I want to ask your opinion about it. The fact that previously I was able to achieve low GKI number with lion diet, high fat diet. But these days I realized that my GKI number isn't so low. This is my assumption. I want to know your opinion. I've been on carnivore keto nearly 8 years. Prolonged keto dieters, their ketone level drops because of your body becomes very, very efficient for usage of ketone. But I don't think that it is bad sign. What do you take on long ketogenic dieters' ketone levels?
Yeah, that's something that, even guys like Steve Finney, who has been a pioneer in the world of ketogenic diets, initially their definition for nutritional, they use the number 0.5 millimolar. And after running the VertiClinic data, they started to see people long-term were getting less and less ketones. So they've revised that down lower to 0.3. So they're realizing, we've seen studies in, say, athletes that become keto adapted, that they are able to use ketones more efficiently. I did an interview with a guy named Phil Prims the other day, and showing that even at 90% VO2 max, they're able to use pretty much all fat, all ketones for that fuel. So I think there is some keto adaptation with regard to how much you can utilize. We don't have this extra energy floating around in our blood, which is arguably a good thing. We wouldn't celebrate high blood glucose, which is just, again, energy floating around. Our brain is probably the greatest utilizer of the ketones. I don't know if people know that, even more so than our muscle is. We can get adapted to it. And I do think you do see that over time, on even a steady state, your ketones maybe drop as you get more efficient at utilizing them. I think that's
do you think that this adaptation inhibits cancer treatment?
I don't know the answer to that. I really don't.
Actually, you said the exact same thing. I asked the same question to Dr. Sorry.
Yeah, because I don't think it's known. Obviously, you would be better served to ask people like perhaps Thomas Seyfried or some of the other dentists.
I asked him.
What did
same
he
question.
Say?
He said, I don't know. He said exact same thing because he hasn't taken care of the long patient who've been on the ketogenic diet approach.
Yeah, it might
she
be
doesn't have a data yet.
Speaking of long-term cancer survivors, there's several out there. I've interviewed guys like Andrew Scarborough and some of the others that had brain cancer. The other guy's name, I can't remember his name, Pedro or something or another, I believe. But those guys, they probably have some insight into it as well. Again, we're in areas where there's not much data. There's just not many human. There's really no real long-term human trials.
Right.
Just
a few
anecdotes at this point. It's one of those things where, your data, whatever data you have, is probably going to be relevant to anybody else who wants to try this. And so it may be.
I am making a new record.
Well, you are pioneering this, and so as are the other patients.
I'm cutting edge.
Tried this, so it might be that just for posterity's sake, to make sure you record your data, put it there so you can share it with the world, and then as people progress, because there may be more people. I'm sure there'll be more people that will try using animal-based and ketogenic diets too. The folks, and you may have reached out to the folks over in Hungary, the Paleomedicina folks, because they've got a fair number of cancer patients they've treated with advanced cancer with ketogenic carnivore style diets. They call it a PKD, Paleolithic ketogenic diet is what they call it. So there may be some. I suspect that there is some level of adaptation to ketosis to where you don't see these, because most people. You see it because a lot of people, when they first go into ketogenic, their breath will change. They'll be breathing out ketones and they're like, this is weird. And then that goes away. And that's usually the waste products. So when you're wasting more ketones, you excrete it, you sweat it out, you urinate it
doesn't make sense, physiologically speaking. You are wasting something, which is just something your body doesn't want to do.
Ultimately, our body is designed not to waste things. We're pretty well designed when we're working optimally. And so I think it just doesn't make sense that we would be producing all this fuel that we would not then be utilizing just to waste it. So I suspect there is some level of adaptation there. And,
I see. Another next question is that I sometimes get asked about calcium supplementation in the contents of Be on a Carnivore. Shawn, you don't supplement anything. Everybody knows. And you don't eat fish. Like anchovies and some bone fish.
No, I have a piece of fish once in a while, but not really.
Yeah, once in a blue moon, not the daily consumption. Yes. What do you think that anybody already know that supplementation for calcium is not so conducive to bone health, but still calcium, your body needs it, and we don't drink mineral water in this context. What do you think about calcium?
So it's interesting. Traditionally, the USRDA recommends something like 1,200 milligrams a day of calcium, right? And surprisingly, there's a guy named Walter Willett, who's a big plant-based advocate. He has actually come back and said, no, we don't need that much calcium. We need actually half that much calcium. And so meat does have some calcium. It doesn't have a lot, but it does have some. Particularly as we're adults, we also know that, for instance, calcium absorption is greatly enhanced on a higher on a higher protein setting.
Oh, okay.
And so a carnivore diet, almost by definition, is higher protein than most diets. Unless you're doing your darndest to restrict protein, then it might not be. But so I think you're seeing greater calcium absorption without the carbohydrates and all the glucose and the high enough adequate amounts of protein. And then the requirements may be less than what we previously thought they were. At the end of the day, what I'm seeing is people that have been on strict carnivore diets, just red meat and water for many years, don't seem to be suffering any major calcium deficiencies. They don't seem to have any higher rates of osteoporosis or anything like that. There is some evidence that I've seen some studies on Eskimo or Inuit populations where they had lower bone mineral density in some cases, but they didn't have fracture rates. So the bone remodeling that they perhaps adapted to where they didn't need as much calcium in it. Because there's no real calcium in an Inuit diet other than you might argue, obviously what's in the meat, the small amounts in the meat. Maybe some people claim they were eating fish bones, but I don't know that's likely. I think
more quality matters rather than density, the volume, isn't it? Structure-wise.
Yeah, obviously absorption, bioavailability are going to make a difference. And if we think about where do we get our calcium from in a standard U.S. diet, a lot of it comes from dairy products, of course.
Or fortified something.
It could be fortified with vitamin D and things like that. But then there is, what was I going to say? There is calcium that's in like leafy green vegetables. You hear about that, but that's really not it's very limited. So again, the recommendations, RDA recommendations based on a mixed diet are probably in excess of what we actually need. Now, as an orthopedic surgeon, I was trained to say, if you have a fracture, you need 1,500 milligrams a day. And if you're pregnant, you might need more. And lactation, you might need more, and those types of things. But again, it depends on where the source is, right? And so if you're getting all your calcium from animal products, either dairy or non-dairy, it's going to likely be more highly bioavailable. If you're on a higher protein diet, which a carnivore diet almost always is, once again, you probably are absorbing even more of it.
And it is some training.
What's that?
It is some training. Something gravity onto your bone is necessary.
Yeah, stimulation.
Aside from the supplementation.
Bone mineral density, obviously resistance training is huge. Interesting because Amber O'Hearn, who someone I have a lot of admiration and respect for, I think she's quite bright.
Yeah, beautiful.
She had written a paper, actually. She's got a published paper, scientific paper on the nutritional adequacies of carnivore diets, and literally the only nutrient of concern she had was calcium. She says, I'm not sure. So I think that is a fair question because I don't think we can say this is exactly where the calcium. You probably will not meet your current RDA requirements on a carnivore diet unless you consume dairy, and some people do.
Right.
So it's one of those things that there's a lot of unknowns. That's just the way it is. There's just things we just don't know yet.
One of the things that can I ask you one more little question?
Sure.
We have a time
we got about 5 minutes and I got to go to another meeting. So sure.
Fair enough. Last question is that this day, this low carb community, they started to talk about you have to burn sugar and the fat alternatively, meaning that the metabolic flexibility matters rather than being on just a keto fat oxidation for, let's say, optimal health. What your take on this?
I don't think you can make the claim that for optimal health you have to do that. Now, I think if your preference is to be able to go back and forth, then it makes sense to be metabolically flexible in that regard. But you're still utilizing glucose. Your blood glucose is never zero. It's always whatever it is, 60 milligrams per deciliter, 70 milligrams per deciliter. It's never zero. There is some concern that, if you chronically are triggering gluconeogenesis or trying to fuel your glucose needs through those sort of mechanisms, that's going to be stressful to the body, and you're going to have this hypercortisolemia, too much cortisol.
I don't think so.
You don't see that long term. That in the short term, but long term follow-up studies don't seem to indicate that. The other thing to indicate is even if you develop some level of hypoglycemia, most of that is taken care of by glucagon and norepinephrine. You don't even touch cortisol. So Amber has written on this and produced the literature that supports that. Yeah. So I think that I think it's perfectly fine to stay on a carnivore diet for many years, even the rest of your life. And you're fine. But if you decide that, hey, I want to from time to time dabble and have this or that, then
keto cycling and stuff.
Yeah, then you might have to go through an adaptation period. And is it better or worse? I can't say. I think optimal is really hard to say. It's one of those things that some people prefer it. They just they like a justification. Well, I want to have a piece of chocolate cake once in a while, so I'm going to be metabolically flexible now. Or maybe just to justify.
You can get away with it. But
well,
people,
it may just be some way to rationalize they want some food that they like sweet stuff. That's very likely is what it is.
If you have a eating disorder history, there is no such a thing. You have to avoid the so-called sugar burning mode.
Yeah.
That's going to screw you. And also, sorry, go on.
I was just going to say, I think we delved into this last time and it didn't get recorded, but the way they treat eating disorders, if you get checked into an inpatient facility for anorexia, they're going to feed you junk food.
I know.
And it's horrible. It makes
you have to eat a cupcake to show that you are recovered, right?
Yeah, exactly.
It's crazy.
They have like food desensitization. There are no bad foods. And they have, in fact, I was talking to a couple dietitians that were, as part of their education, they had to spend a time with an eating disorder unit. And they had to participate with the patients in saying, today's going to be pizza day and tomorrow's going to be cupcake day. So we can show you that these foods are acceptable. And so they were forced to eat them with the patients and they're carnivore. They're like, I don't want to do this.
No way.
Right,
their brain confused, absolutely screwed.
Yeah, it's amazing. So anyway.
Thank you.
Yeah, Sami, thank you once again and continued success. And we keep being inspiring. I know a lot of people are watching you and cheering for you and pulling for you. And I hope to, like I said, well, the 5-year point is when most people often are considered a cure. So I like to do it. When you get to the 5-year point in about a year and a half, let's do another one of these and we can
please invite me again.
All right. Awesome. Sami.
Thank you very much.
All right. Thank you very much.